Dr. Jaffe, what would be the best PERQ supplements to consider for one with hypertriglyceridemia, as well as the optimal dietary changes to make to reduce triglycerides prior to considering the use of medications?
Yes, in regard to hypertriglyceridemia or fat in the bloodstream, do a digestive transit time, a C cleanse, check your hydration status, check your urine pH. These are the 4 self-assessments that lead us quickly to the predictive biomarkers. At least the LRA test, and for 60 days, become a modified vegetarian. If you eat low on the food chain of whole foods with lots of seasonings and spices, with lots of savory elements, look at the links to the recipes that we recommend that are all good and no bad, yet nutritious, delicious, and we have taste tested these recipes and find them yummy. So I've had people come in who report from their clinical colleague, from their clinician, that their triglycerides are 1,000. That's high. And 2 months later, they're completely benign. And by that, I mean 150, 200. There is a big misunderstanding. Fat in the bloodstream means a need for membrane repair. So hypertriglyceridemia is a cry for help. It's not a reason to suppress the poor triglycerides. They're trying to do their job. And having studied animal models of heart disease, where our foxhound dogs or Yucatan mini pigs could have cholesterols of 1,000, triglycerides of 1,000, and no, as in not any heart disease. Or they can have lower levels, but have certain oxidative damage that induces the very harm that we're trying to prevent when we look at triglycerides as somehow an enemy. So please understand that triglycerides go up when you need repair. If you have a repair deficit, your triglycerides will go up. And once you have completed your repair process, your triglycerides come back down. And if you want to jumpstart that process, use the LRA to decide which fruits and vegetables, which herbs and seasonings, which mushrooms and other whole foods low on the food chain are compatible with your digestive tract at this moment in time. Because very often people are eating foods that are stimulating a need for repair because of immune reactions that are occurring from what they're eating. Now, they don't know this. It's happening. We can easily confirm it. But until you have the information, it's hard to take action. So I know there are people who are categorical. Do this and don't do that. I'm much more individual. We can help coach people so that what they eat and drink, think, and do promotes well-being. And we do that individually. We don't have the solution for everyone. It's not a one-size-fits-all. Look at how different people's faces and fingerprints are. When you really get down to the individual, it is quite individual. So start with our self-assessments and our predictive biomarkers. Look from the perspective of what you eat and drink, think, and do, because these are things you can absolutely influence for the better or the worse. And we recommend the better.